Good afternoon. Today's procedure we are doing is a pre-prosthetic surgery called alveoplasty. My staff is preparing for the surgery. I thought I'll discuss the surgery with you. So pre-prosthetic surgery, as the name suggests, is pre as in before, prosthetics as in giving a prosthesis. Prosthesis as a replacement of a teeth. Today's procedure is a complete denture patient in whom there are some sharp bony edges after extractions and some high fiber attachments which attaches to the lip to the bone called frenums. So Dr. Neha has referred this patient to me. Dr. Neha is a prosthodontist. Dr. Neha has examined this patient before doing the complete denture, and in the examination what she has identified as that the patient do have sharp bony spicules and high frenum attachments, that is a fibrous attachment which is attaching very high onto the bone. So this patient will have a problem of having ulcers and maybe dislodgement after the complete denture because of the lip movement. This fiber moves and any mobile structure or mobile tissue around the complete denture will have some irritation because the denture is a hard acrylic. Pre-prosthetic surgeries are many. Most commonly done is alveoloplasty. So alveoloplasty, as the name suggests, alveolo is a bone, plasty is a shaping or smoothing or making it more compatible for taking or getting a complete denture. Alveoloplasty is where we open the bone, open the area where there is a sharp spicules, and these sharp spicules are there because of the extraction. The bone between two teeth is sharp in naturally that sharp. They're pointed because teeth do have a rounded structure in that area, and between two teeth there is a sharp bone. If the extraction is done quite old and let it heal as it is, this area normally becomes rounded and becomes smoother. But if recently planned extraction for the complete denture is done and we are planning for a complete denture pretty soon, this area sometimes remains very sharp. So this sharper area becomes very uncomfortable to the patient if patient eats onto that and the complete denture is delivered without reducing these sharper edges or without smoothing these sharper edges. These sharper edges are smoothen out into alveoloplasty procedures. In this patient we are smoothing two areas, in upper right canine area and lower frontal area, and there are some frenums into the lips which are attaching the lip to the bone are high, and we're going to reduce that also. We're going to reduce this high frenum attachment, reduce the bands, detach the bands, and make that area more smoother. As a complete denture, which is a specialty of a prosthodontist, this multidisciplinary approach where a prosthodontist or oral surgeon, they both work together, the complete denture the final product as the complete denture, which becomes the ideal, more comfortable procedures. Pre-prosthetic surgeries are generally not done and not identified by a general dentist, and a complete dentures are being delivered without doing these procedures. Patient always remains uncomfortable. They always do complaint of some or other area which is hurting them or causing a discomfort to them, and then complete dentures are getting a bad name that they're very uncomfortable. Complete dentures is a very good treatment option for the patient who cannot do a surgery because of the health problem or because of the financial reasons. Complete dentures are very inexpensive compared to a complete implant rehabilitations, and a patient, because of the medical conditions, cannot do a bigger procedures. It is the best option for them. Prosthodontist is the main specialty who take care of complete dentures. Maxillofacial surgeon now is just a supportive specialty who helps them get this base prepared onto which they can prepare their complete dentures. So the surgery is already been planned. I think we are ready now and we'll go and do this surgery. Thank you. So this is a bony spicule after the extraction. So these are the recent extraction. It's been a month already, but this sharp bony spicule is gonna trouble him when he's gonna wear a denture. There is a big undercut. The undercut is a deep cavity below this excessive bone. So this was not an excessive bone. This bone was holding the tooth here. Other teeth are extracted before this tooth. So what happened is the bone has collapsed and became a well-rounded bone. Here, this because of the recent extraction, the remodeling will take long time. If we wait, maybe this area become round like this, but patient will require a denture immediately after all the extractions. So this area is where we're gonna open up and make this smoother. Now another finding is this tissue, band of tissue. These are called labial frenum. So he has a lot of labial frenums, 1, 2. One we have already removed. But these all excessive tissue is again gonna hamper his denture, and when he's gonna speak, this denture is gonna come out. So this movement of this either will take out the denture or will have ulcers onto this bands. So we're gonna extract, or we're gonna reduce these bands. We're gonna detach these bands and do a procedure called labial frenectomy. So this is labial frenectomy with alveoloplasty. Combined procedure is called PREPROSTHETIC surgery. Another area here is this sharp spicule. Relax uncle. So this sharp bone here, again there are undercuts here below this. Relax your muscle, this muscle, yeah. So this bone here is again a sharp spicule which is gonna create a problem for him. I'm gonna do alveoloplasty in this area also.